The hallmark of myasthenia gravis is muscle weakness that typically worsens with activity. The muscle weakness is caused by autoantibodies produced by the immune system that interfere with the transmission of nerve impulses from the nerve to the muscle. Because the nerve impulses cannot reach the muscle properly, the muscle is unable to contract effectively, and this causes weakness. When the muscles controlling the eyes are affected, this throws the alignment of the eyes off and causes double vision. But double vision is sometimes a baffling symptom. Double vision, which is called diplopia in medical terminology, has a long list of potential causes. And myasthenia gravis is not the only condition that can present with weakness and double vision. This can make differentiating myasthenia gravis from other potential causes of double vision a challenging endeavor. LEMS, or Lambert Eaton Myasthenic Syndrome, for example, can also present with muscle weakness and double vision. But in contrast to muscle weakness that we see in myasthenia gravis, the muscle weakness that we see in LEMS improves with repeated action. LEMS is typically associated with certain types of lung cancer and results from the immune system attacking voltage-gated calcium channels on the nerves. This impairs the release of the neurotransmitter acetylcholine, thereby disrupting the contraction of muscles. Multiple sclerosis may also present with muscle weakness and eye symptoms, including droopy eyes and double vision. Both multiple sclerosis and myasthenia gravis can present with the waxing and waning of symptoms. But the deep tendon reflexes in myasthenia gravis remain normal or are slightly dampened, whereas the deep tendon reflexes in multiple sclerosis are typically heightened. A rarer cause of double vision is cavernous sinus thrombosis, which is the formation of a blood clot in the cavernous sinus in the brain. Multiple nerves that are involved in the movement of the eyes run through the cavernous sinus, and any blood clots that form in this structure can hamper eye movement and lead to double vision. Cavernous sinus thrombosis can result from infections in the head, such as sinusitis or otitis, infections in the ear, or dental infections. It can also occur from non-infectious causes. Certain types of brain tumors, known as gliomas, may cause double vision and mimic myasthenia gravis. This occurs if these tumors occur in the brainstem, and like myasthenia gravis, they can cause balance problems and weakness. However, brainstem tumors are often accompanied by signs of increased intracranial pressure, such as nausea and vomiting and headaches, setting them apart from myasthenia gravis. Botulism is a disorder that is caused by the ingestion of a toxin produced by certain types of bacteria known as Clostridia. Botulism can present with droopy eyes, drooling, double vision, and weakness. However, unlike myasthenia gravis, the weakness in botulism comes on suddenly and does not improve with rest. The botulism toxin causes an irreversible blockade of the release of acetylcholine from the nerve endings, and it is the most potent toxin known. Tic paralysis is a particular type of weakness that arises from the ingestion of a toxin found in the saliva of several different species of ticks. This condition presents with a loss of control of the muscles in the lower extremities known as ataxia, and it progresses upwards. Tic paralysis can be accompanied by difficulty speaking, difficulty swallowing, and double vision. Tic paralysis occurs when ticks attach themselves and inject this potent salivary toxin into individuals, which inhibits the release of acetylcholine at nerve endings. Polymyositis and dermatomyositis are autoimmune diseases of the muscle that are characterized by symmetric proximal muscle weakness that is caused by inflammation of the muscle. In dermatomyositis, there is a characteristic skin rash that can differentiate it from polymyositis and from myasthenia gravis. Both of these muscle conditions can present with muscle weakness, droopy eyes, and double vision. A differentiating feature is the presence of pain, which is not typically seen in myasthenia gravis. We can also encounter double vision in TED, or thyroid eye disease, sometimes called Graves' ophthalmopathy. Fat cells and other connective tissue cells in the eye socket contain the same thyroid hormone receptors that the immune system attacks in the thyroid gland in Graves' disease. Consequently, the immune system causes inflammation in the eye socket, which damages the muscles that control eye movement and cause double vision. One differentiating feature is the presence of droopy eyes in myasthenia gravis, whereas in Graves' disease, the eyes are wide open due to retraction of the eyelid. Although the clinical differentiation of these conditions can be exhausting, laboratory, radiologic, and neurodiagnostic testing can help doctors differentiate between these different conditions. Double vision or diplopia can present a diagnostic challenge, even in patients with myasthenia gravis. I hope you enjoyed this video. If you did, like and share with your friends and family. Support the channel by subscribing. Until the next video, stay healthy and stay safe.